Hello. Are we on? There we go. Good afternoon, ladies and gentlemen. So, welcome to the fifth session of the CPR competition. The team that are due to start us off at 2 o'clock, the Training and Education Centre, are a no-show. Okay, so they have not turned up and they therefore are disqualified from the competition. So we will stick to schedule, and the next team that will be starting at 2:30 are the second Danish team. So we'll see you then. Good afternoon again, ladies and gentlemen. It falls to me to bring be the bearer of bad tidings once more. So the team that we're scheduled to be on now are the Danish team. They are also a no-show. So the second Danish team that entered the competition haven't shown up. So again, they are disqualified. We will reconvene. The next competitors will be Portugal. I believe that's at 3 o'clock.
You take that. You sure?
Yeah.
Maybe invite them? We've got 5 minutes. 5 minutes. 5 minutes? 5 minutes to go. So you all the time? Hello again, ladies and gentlemen. Now we've got the next team ready to go. Please welcome a team who's come all the way from Portugal.
Okay.
Hello.
Hi, hello. So who's the team leader?
I am.
It's you.
I don't think this is on.
Check the bed first.
Yeah?
Yeah.
Yes. Can
We
we
want
have
to
some few
Please.
minutes to check the equipment?
Ah, é super.
Como é que é o coisa?
Para fora. Não fales muito porque tu tens microfone.
Oh, is it okay? Where is the CPR?
Daquele lá. Podes pôr para cima?
O botão aí? O botão aí? Ok. Are you ready, team?
Espera aí, espera aí. Não. Ok.
Um problema com o meu microfone. Cagar para o assunto, fiquei aqui.
Sorry.
Okay, so a junior nurse calls you over to her patient as she's worried about him. And the patient's name is Hans.
Hans.
He's 80 years old
Okay.
and has attended the emergency department with a 3-day history of diarrhea and vomiting.
With diarrhea?
Diarrhea and
Okay.
vomiting. And he is on antihypertensives.
Okay.
He's now pale and clammy, and you're asked to assess him urgently.
Okay, we are in the ER or
You are in the emergency department, so could you just
Okay.
repeat the scenario?
Yes, so we have Mr. Hans, 80-year-old.
Yes.
He's in the ER and because of a diarrhea and vomiting for some few days, 3 days, right?
Yes.
And he's now clammy and on antihypertension
Yes.
medication. And the nurse is calling us for help, right?
Yes, that's
Is
right. Yeah.
Is it okay?
So are you set to go?
Are we? I think we are. Can we
Allocate tasks?
allocate tasks?
Yeah, you
right
can
now?
have a short time to allocate
So-
your team.
Mary, are you comfortable with the airway?
Yes.
Mariana.
Okay. Paula and Miguel are doing compressions if needed, and
I'll take the
Isabel will take the defibrillator.
Yeah.
Okay.
Okay, so you're set.
So we have safety conditions to approach
You have safe
the patient.
conditions and you cannot proceed, so off we
Okay.
go.
Okay.
It's your patient.
Mr. Hans. Mr. Hans.
He's not responding.
Okay. Do we have any signs of circulation? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
No pulse and no
Okay,
breathing.
using CPR, let's start compressions. Okay. Isabel, can you monitor the patient as soon as
I'm on it.
possible?
Yes.
So we have 30 compressions to ventilations.
Keep on compressions.
And Miguel, you're preparing to get an IV line, right?
line,
Can
okay.
you try to prepare also 1 milligram of adrenaline and 3 milligrams of amiodarone.
Okay.
Can you do that?
I'll
Okay.
prepare.
Just prepare it. And let me know when you have the IV line ready.
IV line ready.
Okay. And I want you to change with Paula every cycle, okay? With compressions, so she doesn't get tired.
Yeah.
Mariana, are you having any difficulties
stop.
breathing, ventilating the patient?
Martha,
Okay.
We have a shockable rhythm.
Shockable rhythm, let's prepare for shocking.
Okay, keep on compressions. Everybody else stand clear. Okay, keep on compressions. Charging. What happened? Okay, keep on compressions.
It's this one.
It's not charging. Okay, let's check the keep on compressions. I will check the material.
Yep.
Yeah. Okay. Keep on compressions and ventilations, please. Okay. This one is. Okay. No problem. I'll do it. I'll do it. Keep on compressions, please. Just solving the problem. Okay, you can stop compressions now. Okay, I'll
Shockable,
resume
restart.
compressions. Everybody else stand clear. I'm charging now. Paul, stand clear. Shock. Resume compressions, please.
Okay. So Mariana, can you have...
A laryngeal mask.
Okay.
Okay.
Can you try that? So, we're going to keep this for... Isabel, are you managing the time for me?
Yes.
Let me know when we reach the 2 minutes or the 5 cycles.
Okay.
So this patient is an 80-year-old
Tenho que
guy
fixar.
with a history of diarrhea and vomiting with an
Sim. Vai-me buscar
antihypertensive
o-
medication.
Entitle. Paula?
Did you manage the airway, Mariana?
Yes.
Okay, airway secured. So I
I
was
need
thinking
the
of,
entitle CO2.
we have entitled.
Olha, o que é que se
Do we
passa
have a
nesta
value?
merda?
What's the monitor telling us?
End tidal CO2.
Yes.
It's 2.1 kilopascal.
Okay. So I was thinking, Tim, help me. I was thinking about causes for this crash.
You want me to check the... I don't know, we have still 1 minute for the
Yes.
next rhythm check. Check the
Yes,
shock.
family and his history,
The chunk.
but probably some ionic
Yeah.
causes with his history of diarrhea. So I think we can start by asking
Checking the
a family and his history. Can you do that for me, Isabel?
Yes.
Do you think we'd still have time? You're managing.
Probably after the next
Okay.
rhythm check, because
Okay.
now we are about to...
Everything good with ventilation, Mariana?
Ok.
Yes?
Okay, we
Okay.
have 15 seconds for the
15
next
seconds
rhythm
for
check.
rhythm check. And Paula and Miguel are changing again.
Marta, I need the entitle CO2, please.
It's 21.
Ah,
It's okay.
ok.
Okay. So let's stop Miguel for rhythm evaluation.
Okay, shockable rhythm, resume compressions. And charging again. Everybody
second
else stand
shock.
clear, please. Miguel, stop compressions. Shock will resume compressions, please.
Okay, second shock, Miguel, confirm we have adrenaline and amiodarone if in case of the third shock. Okay, next shock we'll think about that. So Isabel is trying to confirm with the family and medical records. And we're trying to
Miguel,
check
tenta-
for other causes. Miguel, are
May
you
I have
free?
lab results?
Are you free?
Yes, you have
Can you
the lab
check for
results.
his
Yes.
temperature,
So
please?
the pH is 7.1.
7.1.
The
pH.
PO2 is 12 kilopascal.
Can you give me in millimeters?
90 millimeters mercury.
19.
90.
90.
90. Yeah.
90 millimeters of
PO2.
PCO2 is 7.2, 17.2.
17.2.
Okay.
Tentăm trucar fixador, că
Bicarbonate
nu
is
consigo
10.
puxar
Okay.
isso.
Basic excess is -9.
Minus 9.
Glucose is 4.5 millimole per liters.
And milligrams?
That's that's 80 milligrams per
Thank you.
deciliter.
Thank you.
Yeah. And the potassium is 7.3 millimole per liters.
Okay. Okay.
And creatinine is 863.
And milligrams?
So we're on continuous ventilation,
I
right?
don't have it here in
Yeah.
It's high.
milligrams.
It's
Yeah.
high, right?
Yeah.
It's high.
Yes, it's high.
Okay.
Isabel, can you check
Okay.
the time and then you confirm all the information you got?
Okay. We still have time. I
Okay.
can tell you the lab results. So he have hyperkalemia with a
Hypo? Yes.
hyper with a potassium of
Yes.
7.3, and
Okay.
you have acidosis with acidemia with a pH
Okay.
of 7.1.
It's according to our thoughts, right?
Yes, and bicarb.
Okay. So,
I forgot.
Okay. So we can start by...
Okay, 10 minutes
okay.
for next rhythm check.
10 seconds, right?
10 seconds, yeah.
Okay, okay, okay.
Let's
so
do
let's
it 10
prepare
seconds.
for...
Okay, on 30. Now.
Let's stop, Paula.
Okay, no, resume compressions, Miguel, please.
It's a rhythm compatible with-
sorry, it's an organized rhythm, yeah?
No
Stop.
pulse.
It's
No
an organized
pulse.
rhythm.
Let's resume
No
compressions.
Yeah,
Sorry.
it's not probable.
So about the cause.
Yeah, we have the potassium.
Yes, we have good potassium. We can alert. Yes, we can do bicarbs.
Yeah.
Yes, and we can also do the adrenaline 1 milligram and 300 milligrams of... no, sorry, we only have the second shock, Paula. Second shock, it's not...
Yep.
Yes, adrenaline, only the adrenaline. I was saying amiodarone. And the bicarbonate, we can... Okay, adrenaline in. And we can also alert, if possible, the nephrology team, because if we can...
Anticipate dialysis.
Yes.
Okay, anticipate the
It
need
can
for
be needed.
dialysis.
Okay.
We would like to alert the team for that.
Okay.
Everything good,
it is
Mariana?
alerted.
Okay.
Yes.
It's done, Marta.
Ciao.
Okay.
Yes.
Marta, it's done. I called the team. Not available yet.
Bicarbonate is in? Okay, thank you. Sorry, Isabel.
It's okay. I already alert the team.
Okay,
and,
thank you.
Not available yet.
Okay, so other things, I was asking Miguel early, but I can ask Paula because he didn't get the temperature of the patient.
Okay.
We already know the probable cause, but the temperature of the patient.
The temperature is normal. It's 37 degrees.
Okay,
centigrade.
probably, I believe, dehydrated, not
It's
clammy.
yeah.
You want
Okay.
volume?
It looks clammy. Yeah.
Clammy. Okay.
Clammy.
So,
Okay,
other
10
inputs,
minutes.
team, seconds.
10 seconds.
Okay.
I think.
Other inputs, team, right now. Let's
Volume?
prepare for
Volume?
it's in.
Okay. Okay, now
Can we
it's
stop
Yeah.
for rhythm evaluation? It's an organized,
Organized
rhythm.
rhythm. Yeah. Check for pulse.
You can. You have a pulse.
We have a pulse.
We do?
So let's start an ABCD evaluation.
Okay.
So,
Mariana, any problem? Airway secured, right?
Yes. I
Is
would
he-
need
is he
to
having
put
any-
a definitive airway?
We need a definitive airway. Okay, we can call
Pulse
the
O2.
anesthetist.
Can you
Are you
attach?
is he having any ventilatory effort?
No.
Or are you? No?
You can.
No effort.
No effort. So
No.
keep on doing the ventilation. Miguel, can you check breath sounds for me? Are they symmetrical?
They
Good
are symmetrical on
expansion?
both sides and normal.
Okay, and good expansion bilaterally? No
Yes.
problem with that. Okay, so can you have an SpO2? Thank you, Paula.
You're
Value.
already done?
Do we have an SpO2 value?
We have an SpO2 of 95.
95. Okay, so for now,
Its peripheral pulses are palpable.
okay, C. And do we have an
Final.
arterial tension evaluation right now?
3
Blood
seconds. RCT is 3 seconds. Yes.
Blood pressure
Blood
evaluating?
pressure,
Blood
yes.
pressure is 100
So
to 40.
ECG.
What? Sorry.
100 to 40.
Okay. And we can ask for who's free. Miguel is free. Can you go ask for the EKG machine,
Well,
please?
I can do it. I can do
Yes,
it.
we have on the, sorry.
Okay.
Okay.
Let's put another IV. Another
No
IV.
signs of myocardial infarction.
Okay, no
No
signs,
signs,
of my
but we have
MI.
any other?
No abnormalities. No.
Okay.
I have a second IV,
So
and
my-
I took the blood gases and all the samples, blood samples.
Okay, so we have an IV and an ABG collected,
Yes.
and blood samples with renal function and ions. That's our main
Okay.
concern. Okay, and we are putting a vesicle tube.
Okay.
Okay, and
Chest X-ray. Chest X-ray then?
okay. Then neurologically, I can see his pupils are
Not reacting.
not reactive to light. Okay. Does he have any response to voice or pain?
No response.
No. Okay. And no lateralization.
No.
Okay. In his ABG, can we get his glycemia?
Yeah, the machine is calibrating. You will get
Okay,
it soon.
we'll be having that value then. And then for exposition, are we seeing anything out of the expected?
No.
Behind,
No trauma. or
beyond
anything else.
the claimy skin? Okay, so we need to prepare for transfer. I think we are in the emergency department. Maybe call the ICU team
Okay.
and transfer these patients and ask again for nephrology and wait for all the results we have pending.
Okay, so then I want to thank your team. We'll stop the scenario here.
Thank you.
Good girls.
Os óculos.
Os óculos estão aqui.
Obrigado.
Thank you. Happy? Right, thank you very much. Thank you to Portugal there. So my name is Claire. I'm one of the judges, so thank you.
Thank you.
Now, what we're going to do, I'm going to do some feedback with you, okay? See how you thought that went, and then we'll have a few discussion points, okay?
Okay.
First of all, to the team leader,
Yes.
how do you feel that went?
I think it went reasonably well. I think I felt comfortable with the team, and I think the team felt comfortable. They were giving a lot of feedback and a lot of input to the scene, so I think it went. We had that problem initially with the defibrillation, with the pads, but I think it was overcome.
Right, just to mention, the time we will take as your first, from the collapse to shock time, is your first attempt at shock time, okay? Not counting for the issues you have with pads.
Okay.
So when you first went to it, okay? So to make it fair, does that sound reasonable?
Yes.
Yeah.
Okay, but you dealt with that actually very well as a team, because these things do happen.
Yes.
But you did everything, you carried on with the chest compressions until you had that situation sorted. So that was okay. All right. And then the rest of the team, how did you feel? Your team leader, the communication lines, did you feel comfortable with it all?
Okay. Oh.
I think the team felt comfortable. We had allocated our tasks, so we know exactly where to put ourselves in the scenery and what we had to do. We communicated well. We knew what each other was capable of. So the team leader's orders were direct and clear. So it helped us to feel comfortable because we were technically prepared to what we had to do. We knew the timings, and the team leader was right on with the times and all the tasks we had to perform.
Shoot all the same thing.
Okay, and just a couple of things. There was one pulse check that I think just...
it was me. It was me.
But you realised very quickly,
Oh, yes, I was...
after checking the rhythm. And what was the rhythm, just so everyone can hear?
It was a pulseless electrical activity, and of course...
but you realised very quickly and corrected that. The other thing really just to talk about, it's been an interesting day in the fact that some countries seem to do chest compressions on the bed, some do it on the floor. Is your practice in Portugal commonly you would do it on the bed?
Yes,
or
yes. We do it
in
on
hospital? Yes,
yes,
of course. Yes.
In the hospital we have
that back.
It's adapted for chest compression. So.
Okay, fine. Because I think if some people have watched other competitions and have noticed the patient take off, put on the floor, there was a discussion earlier whether you felt that would actually delay the time to...
We have CPR mode in our beds, and the infection committee wasn't really going to like if we put the patient on the floor, so...
And it would be very difficult for a big patient.
That's very true with infection control.
But I have a micro, thanks. But of course, if your practice is pre-hospital, usually that's what you do. You do it on the floor. Yeah?
Yes.
And the other thing I was going to question was, you'd obviously identified or thought of the cause as hyperkalemia and the vomiting, the dehydration, and a renal cause. Did you, in your mind, go through any of the other reversible causes?
Yes.
And what was your rationale for, did you go through and exclude those?
Well, I think I didn't get the real time to do it, but I was on my mind. I may not have said it, but I was searching for them. That's why I asked for the temperature, and I was searching for some exposition and some signs. Yes. And also the ventilation problems all along the scene. So.
Okay, it's just sometimes handy, just especially as we're all watching, just to verbalise what your thoughts are. Although you did brilliantly under pressure with everyone watching as well. A very tough situation to be in. Okay, so thank you very much. Have you got anything else you'd like to say?
No.
Thank you for letting us be here.
Well, thank you very much, Portugal.
And thank you for the audience.
Thank you. So, ladies and gentlemen, that concludes the preliminary rounds of the CPR competition. The judges will be now deliberating for the next short while. The results will come up on the big screen here during the last session of Congress today, and they will also appear on your app. So make sure you update your ERC Congress app frequently. And the final tomorrow will start here at 11:30. The top 3 teams with the best scores from this preliminary round will face off each other in a paediatric scenario. We'll see you all then.